Welcome back to What Matters This Week. I'm Lauren Maloney. Joining us again is Dr. Rebecca Bell, president of the Vermont chapter of the American Academy of Pediatrics. Doctor, I appreciate you so much for being here. I know you are so busy right now, and that's why I kind of wanted to bring you in, because I think parents and just about everybody have so many questions right now. So let's start out this way. Is this the worst point in the pandemic for children right now?
Well, lots of children are getting COVID and they're testing positive, and some are getting sick, and there is a lot of disruption in families right now. I will say, though, that we're not seeing a lot of severe pediatric disease. We're not seeing a lot of pediatric hospitalizations, but certainly we have more children now who are testing positive than at any point in the pandemic, and that is causing a ton of disruption.
Do we have any way to know yet whether Omicron in young kids is less severe as it's maybe supposed to be for adults?
Oh, it's certainly less severe than adults. Children always have more mild disease than adults would. I think one of the questions people ask is Omicron less severe than Delta? I think we don't have quite enough evidence to say that for sure. I think there's some emerging evidence that it may cause less severe disease than Delta. However, we still need more information on that. And there are just so many kids getting Omicron compared even to Delta. But yes, children compared to adults, it's still true that children get less severe disease than adults do.
Is there any way to know, and maybe it's too early, that if in general we're seeing less severe cases, less severe disease, then the chances perhaps for long COVID may not be as big as we saw earlier on in the crisis?
That is a great question, and it's a question on every parent's mind. And it's just too early to know. Long COVID is long COVID, right? So we just don't have the data on long COVID and Omicron. We do know that long COVID in general is less prevalent in the pediatric population than it is in the adult population, but we just don't have the data.
I want to talk about schools because I know you are working kind of hand in hand with schools right now. The new policies that were outlined late last week, early this week, are they working? Will they work?
Well, for them to work, we really need more access to rapid antigen tests. And the idea between shifting much of the testing or the contact tracing that's happening in the schools and shifting a little bit more of it to the home is so that the families have more flexibility in how they want to test themselves and test their children. But yes, this really depends on having rapid antigen tests. Certainly the painstaking line lists that the school nurses have been doing is just not something that's going to work in a time of Omicron. And I do think we should all consider ourselves to be close contacts, really. If we're leaving the house, we're probably being exposed to Omicron. And so thinking about that and acting accordingly, whether or not you're told that your child has a close contact at school, I would just assume that they do and assume that we do too, as we go to work and go about our day.
So are there enough antigen tests at the schools right now?
No, they do not have enough tests. And this is a problem nationally. I mean, there just aren't enough tests nationally. What we would like to do, what the Vermont chapter of the American Academy of Pediatrics has recommended, is that all students, whether or not they're vaccinated, have enough access to rapid antigen tests that they could use a couple a week, and they could use it whether they want to use it for asymptomatic screening, whether it's after a contact, whether it's to shorten isolation. The families would have a choice in how they would use it, but there just aren't enough tests right now.
The president says he's working on more tests. He's working on getting masks to more households. Do we have enough little masks for these little faces to put a higher quality mask on our kids?
That's a great question, and masking is so important and something that we can do now and continue to do. I think lots of folks are finding that the pediatric surgical masks are, so the pediatric version of this type of thing, children really can tolerate those types of masks. And so that is another thing our chapter is working on, is advocating for those types of masks to be in the school. Some children, especially older children, really do tolerate the KN95s, And some school districts are working on providing those for their staff and working on providing those for their students as well. But masking is definitely an important part of this picture while we have so much transmission everywhere of Omicron.
Yeah. Dr. Bell, I know you tweet a lot and you'd like to get as much information as you can out there. Something that somebody asked you was, can my young child sleep with a mask on, like take a nap at school with a mask on? And I thought that was something that really hadn't been addressed or talked about yet.
Yeah, well, we did talk about this early on in the pandemic because children were going to childcare and they napped during childcare. And what we recommend in the US, what the CDC and the American Academy of Pediatrics recommends is that children over the age of 2 wear masks. So remember that children under the age of 2 are not wearing masks at all because we want children to be able to safely take their own mask off. Mm-hmm. So those children there are children in childcare 2 and below who are never masked because we're asking them not to. And then we just want to be safe about the masks. And so we do recommend, anytime a child's sleeping, not to have something, near their face or covering their face. So we do recommend taking the masks off for nap time. I have a 4-year-old in childcare. My children were 2 and 4 when the pandemic started, and they've been in childcare this entire time. And it is amazing to see these young kids able to mask. And my kids have been masking for a couple years now, and they're really good about it and responsible about it. And it's just kind of part of their life. But we just to be safe, we do say take them off for napping.
I mean, I think kids are better than adults, right? When it comes to masks, even at this point. Yeah.
Definitely.
The tests for Tots program, this is important too, but as you noted, small children under 2 probably shouldn't use those antigen tests.
Well, they're not authorized for children under 2. So there's no reason to believe that they wouldn't work, but the FDA just tested them on folks 2 and above, which this often happens to this age group, is that something's just not approved for their age group, not because it doesn't work, but because it's just never been tested. But this is a big problem for families of kids in this age group, is that really they have to get a PCR test. And so they have to get an appointment. Even the take-home PCR tests that some of the schools have, I think those are 5 and above. So really trying to figure out what we can do to advocate at the national level to have better access to at-home testing for this age group. But right now at this moment, we don't have something that parents can use at home for these children. And so it really requires going to a site and getting a PCR test.
Okay. Also, the discussion, and a lot of states are talking about this, over whether a child is hospitalized with COVID or for COVID. Either way, hospitals are overwhelmed, right? Does it really matter in the grand scheme?
No, I mean, I think hospital capacity and what the hospital is saying they're seeing is really the most important thing. I will say that especially in pediatrics and especially in a state like Vermont where we have a high vaccination rate, is that just looking at the number of pediatric hospitalizations is absolutely not going to give you a full picture of what's going on. We do have a lot of incidental cases, meaning a child comes in for something totally unrelated, a scheduled surgery, a traumatic injury, and we test everybody who gets admitted to the hospital. Everyone gets a COVID test. And so some of those patients are positive. Now it does put a strain on the system, right? Because we have to do special isolation. And then there's oftentimes discussion with family about some restrictions on visitors and moving about the hospital that can also drain the system. But there's a lot of nuance to the pediatric hospitalization number. And so focusing just on the number isn't going to give you the big picture or the complete picture. And I think just reaching out to your local pediatricians and saying, what are you seeing? We certainly see way more hospitalizations for things like respiratory syncytial virus, for instance, in children. So our COVID hospitalization numbers are still at this point on the low side compared to the rest of the country.
We talked about RSV before. Is it still a problem right now in schools? Is it neck and neck with COVID, or what are you seeing?
We are seeing more hospitalizations for RSV definitely than for COVID. And in Vermont, typically RSV peaks in February and March. And we see it through the spring. So we're sort of heading into what we typically see as a peak RSV season, although we saw some over the summer, we saw some in the fall, which was very unusual. So it's hard to predict what that RSV pattern is going to be. But certainly our hospitals, the pediatric side, gets pretty full with patients, really, really sick kids with RSV every winter. Flu as well, not as much. Flu in Vermont tends to peak in late January. And we haven't had a lot of flu admissions among our pediatric population this winter. And I don't know if that's just a difference in the way the virus is acting or if it's people getting their flu shots. I would say it's not too late to get your flu shot, and children 6 months and above can get their flu shot. So that's another thing. I think not to forget about all the other viruses that are going around this time of year.
Dr. Bell, what else do parents out there need to know right now that you really want to drill home?
Well, just that COVID really looks like a lot of other viral infections in kids. And so when parents get that positive COVID test, oftentimes they think, what do I have to look for? Like, what do I have to do? And it's really the same as any other type of virus. And so when you're talking about an infant, for instance, sometimes we see infants who might have some trouble breathing, although we have not seen lower airway disease in infants due to COVID, like we do with RSV. So we don't see a lot of bronchiolitis. We don't see a lot of pneumonia in that age group from COVID. Right now, we see some upper airway breathing difficulties, and really just generally feeling unwell, feeling feverish, and maybe not drinking enough. And they need some IV fluids, or they need to come in because we need to do more testing to make sure they don't have another bacterial infection. And that's actually a really good point to hammer home, is that we also don't want to miss something that's not COVID. There's so much COVID right now that we also don't want to say, oh, this is COVID. And so I think, if you're uncertain about what's going on, certainly talk to your child care provider, your child health provider. As kids get a little bit older, we see, again, we haven't really seen it, but in other states, definitely COVID can trigger asthma. If a child has asthma, it can trigger an asthma exacerbation, just like other viruses might. We haven't seen a lot of pneumonia in the child, sort of like the 5 to 11 age group. In unvaccinated adolescents, we have seen a few cases of really severe COVID pneumonia, like you hear about in the adult population. We saw that with Delta. And I worry about our unvaccinated adolescents because, even with Omicron, I certainly worry that they could get severe disease. And I recommend that everyone gets vaccinated if you're eligible.
Dr. Bell, I appreciate your time. I know you're very busy. Thank you so much.
Thank you for having me.
And since that interview, Dr. Mark Levine and Education Secretary Dan French met with Vermont lawmakers this week. Levine said they received 400,000 antigen tests this week. He said the majority are headed to schools to make the switch from test to stay to test at home. We will be right back.